I'll
Welcome
also
to
say hello. And then
hello,
I'll mute
Michael.
myself. Hi, Bob.
Okay, could we all mute ourselves? I'm about to roll this, other than Dr. Elidio.
Bob, you're muted.
Thank you. Welcome to our December Showcase Tuesday. December is Disease Prevention and Treatment Month in the Rotary calendar. Have you noticed that disease results in misery, pain, and poverty for millions of people worldwide? About 409,000 people died from malaria in 2019. Have you noticed that Rotarians help to treat disease by building hospitals and infrastructure to allow medical personnel, patients, and government to work together? Have you noticed that Rotarians prevent disease by working on health education, screenings, vaccines, supplies, and routine care? I want to welcome you folks to the Showcase Tuesday this month. We have guests in Rotary, outside of Rotary, and we have guests in and outside of District 7430. Rotary's mission statement embraces disease prevention and treatment around the world. You'll know the words, "Together we see a world where people unite and take action to create lasting change across the globe, in our communities, and in ourselves." Tonight, we will learn about a Rotary program to combat malaria through clubs, through the Rotary Foundation cadre of technical advisors, and through the Rotarians Against Malaria Rotary Action Group. Listen to Dr. Noel Elidio describe how we work to eradicate malaria, and until that time, to prevent deaths due to malaria. Our session tonight is being recorded. Your image and speech will become a part of the record. You may ask questions following our speaker. If you prefer to write questions in the chat box, Marlene Heller from our Learning Committee will pose those questions to our speaker. Please mute yourself during the session and unmute at the end of the session to ask questions. It's my pleasure to introduce Dr. Noel Elidio. Dr. Elidio is a physician and Rotarian based in San Juan, Batangas, a municipality in the Philippines. He received his medical degree from the University of Santo Tomas and interned at Santo Tomas University Hospital. He is the administrative officer at St. Francis and Paul General Hospital and is a family physician consultant there and at 3 other hospitals. He served as an officer, director, and member of many medical associations, including as past president of the Philippine Academy of Family Physicians. Dr. Elidio joined the Rotary Club of San Pablo in 1994. He's past president and has held or holds many service positions there. He is the Philippine ambassador for Rotarians Against Malaria, Rotary Action Group, and is a cadre technical officer for RAMG and the Rotary Action Group for Diabetes. I'm going to stop sharing that and ask Dr. Elidio to begin.
Thank you, Bob. Thank you also for inviting me over to talk about my my passion for Rotary, as well as especially in disease prevention and treatment. Can you see the slides?
Yes, we can see them.
Okay, so I'll begin. Again, thank you for the Rotarians of District 7430 and District Governor Bob for inviting me over. And this is a passion that's been with me for quite some time. So I hope I can provide you with insightful meetings so we can all move together in fighting disease and preventing and doing treatment, especially in the area of malaria eradication. So disease prevention and treatment is a very important area of focus for Rotarians because majority of our programs and projects evolves in disease prevention and treatment. Majority of what we do every day, every year in Rotary is concerning disease prevention. So these are very important to us. So the goals of disease prevention and treatment is improving the capacity of local health professionals, promoting disease prevention programs, especially with the onset of COVID-19, the spread of communicable diseases, and then reducing the incidence of non-communicable diseases such as heart diseases, diabetes. We are also involved in enhancing a health infrastructure in local communities and very important in educating and mobilizing communities. So this is a capacity building effort for us. And also we have another goal is preventing physical disability resulting into disease and injury. So Rotary's area of focus. So all know that we have 7 of them, but the World Health Organization has 17 Sustainable Development Goals. Now, if you will note that almost all these 17 Sustainable Development Goals can be aligned with one sustainable goal, which is good health and well-being, which is at the center of the circle there. So we can utilize all the 17 sustainable goals in our effort to attain number 3, good health and well-being. So for example, the number one goal there is no poverty. So we can prioritize health needs of the poor. Number 2 is no hunger, addressing and the causes of consequences in all forms of malnutrition. Number 4 is quality education, supporting high quality education for all to improve the health quality. Number 10, reduce inequalities, ensuring equitable access to health services through universal health coverage based on strong primary care. Number 15 is life on land, promoting health and preventing disease through healthy natural environments. And number 7 is partnership, by mobilizing partners to monitor and attain health-related sustainable development goals. And another good thing about this slide is all these sustainable goals are aligned with Rotary's 7 areas of focus. So each one of those development goals can be fit nicely into 7 of our areas of focus. So Rotary Foundation has summarized everything for us in doing all the things that we need to do for the community. So the areas of focus of disease prevention and treatment, how big this is to us. Now this slide shows us that majority of the global grants sponsored by Rotary clubs and Rotary districts are disease prevention and treatment. So a great number of our grants focuses on disease prevention and treatment, and accordingly, the total funding goes, a big chunk of the funding goes to disease prevention and treatment. So followed by the WASH areas of focus, water, sanitation, and hygiene. So you will know that this is a very important area of focus to all Rotarians all over the world, because this is how much we are involved in disease prevention. Now, there's one disease that I want to interest you in, which is malaria. So malaria is not a new disease, the killer of all time. In 2019, there's an estimated 229 million cases of malaria worldwide. Malaria is a scourge that strikes the hardest on those who are the youngest and the poorest, and on different continents. Rotary ignited the movement among Rotarians to put this treatable, curable, and we expect soon to eradicate this disease as Rotary's next disease target, following the successful multi-decade campaign to overcome polio in other lands. Spearheading is a Rotarian-led fight to end malaria a disease that has killed more than any other disease in the world. So this is the malaria situation right now. It's a life-threatening disease carried by a parasite, carried by the Anopheles mosquito. It's preventable, curable, but it has a disparity among the developing countries. Now, the progress has stalled since 2014, 2015 because of so many challenges. For example, funding, the resistance to our drugs and insecticides, and then the low involvement of community health workers. Now, there's a new vaccine was approved last October, but it's only 30 to 40% efficacy rate with 4 doses. And then the countries affected by malaria is striving hard to be malaria-free status, but it will take 3 years of non-transmission to have a malaria-free status certification from WHO. Now, the incidence of malaria has gone down, but gone down between 2010 and 2018 from 71 to 57 cases per 1,000 population at risk, and also as well as the malaria deaths. But this progress has dramatically slowed down because of what I mentioned, because of the funding and other hurdles that we are encountering right now. Now, there are 229 million cases in 2019 and 409 deaths, but majority is from the African countries. Now, the good news, we have prevented 1.5 million of malaria cases, and also as well as the 7.6 million malaria deaths. Now, malaria is just occurs in this tropical belt, in this warm climate region. So, but I would like to take note that since because it's just a limited pattern of the mosquitoes, just limited to the tropical countries, except for the ones in North Korea. I'm still trying to find out why they have in North Korea a very, very cold climate. So, but we also have the issue of climate change and global warming. So mosquito population could go to areas that is starting to warm up. Now, this is the malaria life cycle. Now, as you can see, on the right side is the mosquito stage, on the left side is the human stage. So when a mosquito bites you, it goes first to your liver, and then it multiplies there. And then there's a cycle within the blood that goes that the larvae goes into the blood, destroys the blood. That's why many of the malaria victims are anemic, because they destroy the red blood cells. And then once the red blood cells are destroyed, they release the gametocytes into the bloodstream. And then the gametocytes goes into the male and female gametes. And then the cycle goes to the mosquito stage. When the mosquito bites an infected human, they ingest the gametocytes. And then within the mosquito, they form the zygote, the oocyst, and then when they hatch, again, the cycle begins with the sporocytes being injected to another human victim. Now, the ultimate goal for malaria, of course, is zero malaria. So how can we involve you in this drive? First, we have to engage you. Make you a club or district advocacy, becoming an ambassador in your club or district. So make this your advocacy in your club or in your district. Those who can lead a campaign awareness to communities, to the clubs, and those people who wants to help the victims of malaria. So you can be an ambassador for this. Second is facilitate small and medium and large Rotary projects in malaria endemic areas. Now, so any intervention to break transmission of malaria is a tool in achieving malaria elimination. So one is vector control. So this is simply a mosquito control by bed nets, indoor spraying, traps, and genetically modified mosquitoes, drug treatment by the disease, environmental management, and environmental intervention to eliminate the breeding sites, train personnel in case detection, surveillance, and monitoring. Now, these are the strategies that Rotarians use to fight malaria. Now, to prevent malaria from stopping transmission, we use the long-lasting insecticide-treated bed nets and residual spraying indoors of houses affected or those with endemic malaria. And of course, we diagnose and treat. So this is the capacity building for community health workers, wherein they go to these endemic areas, use the rapid tests, do contact tracing, and then report this to the centers, and then do the treatment of malaria cases. Another strategy for Rotarians is surveillance. This is very from malaria. So we don't need for malaria to come back to those areas. So we have to do surveillance. So this is very important by still continue using the bed nets and then build on the community health workers to do the surveillance and then monitoring, do the contact tracing. So we have to continue to train these people on the field so they can pursue the treatment of malaria and controlling malaria. Now, the future of malaria, we have newer bed nets with combination of insecticides. There are several chemicals or several in the market being in the research and development. Also for better bed nets. Now, the spatial repellents, these are just level up mosquito coils. Well, the aerosols are being used in large spaces like schools, hospitals to act as repellents. It interferes with mosquitoes' ability to detect the host and avoid being bitten. Now, there are newer drugs, Primaquine Plus. It's a Primaquine with methylene blue that kills the gametocytes. Now, the tafenoquine is also a new drug, but it also inactivates the gametocytes, but it's long-acting. So it has a role for high-risk population. The high-risk populations that are migrating from one area to the other, from free malaria areas to an endemic malaria area. So tafenoquine is a long-lasting drug that can be used for those people going from one place to the other. Now, this is the Oxitex genetically modified mosquito, wherein they only hatch the male mosquitoes. They develop the eggs. The female eggs are aborted, and only the male mosquitoes are released into the field. And then they mate with the female mosquitoes in the field. But once the female mosquito laid the eggs, only the male mosquitoes are live, and then the female mosquitoes are aborted. So these are the new technology that we're employing so that we can control the vector of malaria. Now, Oxitec and Gates Foundation is developing two types of malaria vectors, genetically modified malaria vectors. One is Anopheles albimanus and Anopheles stephensis. These are two important malaria vectors. Now, the Oxitex mosquitoes are only grown. I'd like to again reiterate that they will only release the male mosquitoes. Now, Anopheles albimanus is a vector of concern in the Central American region with 343 million people at risk. And Anopheles stephensi is a vector of concern in South Asia with 2.1 billion people at risk, which is starting to affect the Eastern African countries. Now, Anopheles stephensi is an urban malaria vector that's spreading in Africa. I included this slide for the Engineers Without Borders, so they can see that they have a role in sanitation in the African region. So probably this is where they can put their efforts in helping to control malaria by controlling the breeding sites and improving sanitation in those areas. Ng malaria vaccine, we have the first malaria vaccine, which is Mosquirix. It requires a 3 primary dose and 1 booster dose. Again, it has a low efficacy rate, but it's the WHO gave its go signal for it to be used and for children less than 5 years of age. And it was just approved last October. We have a better vaccine in the trial phase, which has passed the WHO efficacy approval rating of 70%. This one has 77% efficacy shown in the initial trial. So we're looking forward to the probably 5 more vaccines in the trial phases. Now, this project is one of the projects we should, as Rotarians, be proud of, because this is the first program of scale grant awarded to Partners for a Malaria-Free Zambia. Now, I would like to give you some background of the program of scale grant. Now, the program of scale grant is an initiative, is a highly competitive grant program designed to invest a sustainable, evidence-based intervention that address a community-identified need across a significant geographic area and population. A program that is ready to scale up over 3 to 5 years to increase the impact in one of the areas of focus, include measurable outcomes, and demonstrate impact. The grant amount is $2 million, and only 1 grant will be awarded every year. Though the Malaria Partners for Malaria-Free Zambia has the goal to reduce malaria in 10 districts in 2 Zambian provinces, training 380 facility staff and 2,500 new health workers, benefiting 1.3 million people with access to diagnosis and treatment. Now, malaria is a preventable disease, but in Zambia, it's a leading cause of illness and death, especially among infants and pregnant mothers. The Rotary Club of Federal Way, Washington, has been working with partners and Rotary clubs in Zambia and other countries to fight malaria for more than a decade. So the Melinda Gates Foundation and World Vision USA awarded an additional $2 million each, funding to Partners for Malaria-Free Zambia to increase impact and strengthen the country's health system. So this project has a total funding of $6 million. So these are the groups, Rotary groups fighting to end malaria. We have Rotarians Against Malaria Australia, RAM Papua New Guinea, and then Rotarians Eliminating Malaria in Tanzania, Rotarians Eliminating Malaria in Rotary Action Group. Another group, the RAM Global Rotary Action Group, and then we have the RAM Global Ambassadors. So the RAM is working all throughout the globe to eradicate malaria. So RAM PNG program has a successful project on bed nets distribution funded by the Global Fund. Now, this is how they distribute the bed nets, because in Papua New Guinea, there's no readily accessible road. So they have to distribute the bed nets just by carrying on their backs. And the RAM Papua New Guinea has a very successful school program on sensitizing children about malaria. Now, Timor-Leste is very close to malaria elimination. So I think they need just 1 more year of free transmission to have a certification of malaria-free certificate from the WHO. So this project involves 40,000 insecticidal bed nets and also sprayer machines. They also conducted surveillance, capacity building for healthcare workers. So this is to keep the malaria at bay. So they continue to use the bed nets and continue to do the residual spraying and also capacity building for the healthcare workers. So the results, they have zero malaria now, zero transmission, only a few imported cases of malaria. Now, this is the reason why the Timor-Leste is very interesting, because Timor-Leste is malaria-free, but the other side, Indonesia, still has is endemic for malaria with thousands of cases. So the imported cases came from Indonesia, though, because they can freely cross the border from Indonesia to Timor-Leste. So this is very interesting. So they already have Timor-Leste malaria-free. Now they will target the whole island of Timor to be malaria-free. So Venezuela, they also use the bed nets to help eradicate malaria, also with a global grant. And this is how they teach the beneficiaries of how to take care of their bed nets. And then this is very interesting, because this is a project in Uganda. Very high cases of malaria in Uganda, but there are 2 global grants that they've done very, very successfully on two occasions, and they have reduce the malaria cases to a manageable level. So they continue to use very important. It's a template that they continue to use: sprays, bed nets, and capacity building. So they also do some vector control and medical care with mass drug administration. So it goes with the project. So RAM Global members fights malaria across the world. So this is a global effort for Rotarians. So like you I hope you can also join us in this fight. And this is the website if you are interested in visiting it and join us in this fight against malaria. So this is a video. Okay, I think that's my last slide. Yeah, thank you for your kind attention.
Thank you, Dr. Elidio. That was very interesting, and I'm sure we have a lot of questions. And I'm glad that you're here to answer them. Marlene, do we have any questions in the chat box?
We have a couple. First of all, what is the significance of malaria eradication being the first being funded as Rotary's first project of scale?
Yes, thank you for that question. It's a very important question to us because it's the first launch of the program of scale grant. It's because it's the type of grant that we can do sustainable, and we can level it up to other areas of in other geographical areas. So the significance of this is we can fund this has no this is just a plain funding from Rotary Foundation. They can add funding from the local, but the funding is directly from the Rotary Foundation. No need for matching like the global grants. No, it's not like that. So this is a simple TRF funded grant. But other sponsors can join in. Like for example, this grant has been 2 million from Bill and Melinda Gates Foundation, to another 2 million from World Vision. So this is a very important grant because they're teaching us how to do a grant that we can scale up, and we can do it sustainable. So this is how we should do the projects, even though it's ordinary projects, even though it's a simple global grant, but this is how we should do it, on how we can design a project that can be sustainable. It can be scaled up into other areas. For example, you start in one area and then you can do the same project and do the scale up project in the other areas and other populations. So this is how the Rotary Foundation is trying to do a pattern, a template wherein all our projects, all our grants will be similar to this.
Okay. How prevalent is malaria in the Americas?
I think there are no cases in Americas because there's no mosquitoes. No Anopheles. There are mosquitoes, but no Anopheles mosquitoes. So it depends on the mosquito. Yes, we might have mosquito in Florida area.
I think that includes South America and
But it's
Central.
not the type of mosquito that carries malaria.
But
Maybe, Beth.
South America and Central America as well, correct?
Yes, in Central America. In Mexico, they have.
They do. Okay. Can you please comment on the efficacy of the vaccines in development compared to prophylaxis?
Well, prophylaxis is short term. So it's the problem with prophylaxis, you just need it when you but you can still get an infection after prophylaxis. So it's not a long-lasting cure for malaria. Compared to vaccines, it's a better way of preventing malaria because you already have the antibodies to fight malaria before you come into endemic area. But it's still very, very low efficacy rate. So we're still waiting for the better ones.
Okay. I have a couple of questions about the nets, the blue mosquito nets. Are there any studies to show residual effects on humans or pregnancies?
No, they're safe to humans. All the insecticides lined in the bed nets are safe to humans. Only to mosquitoes are there.
What do they do with the bed nets that are turned in after 5 years?
Well, they're giving you ones.
But what do they do with the ones that are turned in? Are they destroyed or are they reused?
No, they retreat it with the chemicals. So they lined it again with new chemicals.
Okay, and then those chemicals, do they kill the mosquitoes or they just keep them away?
Yes. So once the mosquitoes attach to the bed nets, they are killed.
That's great.
Yes. And again, I'd like to mention that for every pregnancy, they're given 1 mosquito bed nets.
Okay. Okay, and is there a relationship of sickle cell to malaria?
Yes. Some of the are not affected by malaria, but there's a more significance to G6PD.
Oh, okay.
Yes, because also has a similar in G6PD the red blood cells hemolyze also once they are exposed to some certain substances. So that's the genetic predisposition of G6PD individuals. G6PD is also sensitive to malaria drugs. So that's a problem. So in the projects there, the community health workers are taught how to screen people with sickle cell and G6PDs.
Okay. Now, you mentioned the cadre. What is a cadre?
Oh, okay. The cadre is a volunteer group under the Rotary Foundation. Now before they used to think of us as auditors. No, but we're not. We're not really auditors. We're here to help you implement how to implement projects, global grants specifically, a better way, or we help you design projects for global grants. So we are here to assist Rotary clubs and Rotary districts in designing global grants that will fit to the areas of focus policies of the Rotary Foundation. So we are here to assist the implementation, to reporting, to doing community assessment, which is, in my experience, is one of the hardest thing that Rotary clubs are trying to overcome is doing community assessment, a detailed, well composed community assessment. So those are all the steps in the creation of a global grant. Cadres are there to assist.
Okay. Do any of the human-related malarias live in other animal hosts?
I think they're in chimpanzees and apes. They're also affected.
Can you comment on social issues in implementing malaria prevention?
Well, in this malaria prevention, because there are cultural issues, especially in the Pacific Islands. So they still have to overcome some cultural issues in I hope that's what they're pertaining to. But in cultural issues, they see that malaria is not a human disease. They think that malaria is still a mosquito disease. So that's the problem. So it's they don't believe that that their people should be treated with malaria because they need just to treat the mosquitoes.
Yeah. Okay. Does anybody else have any
But
other questions?
if they fail to that there's
Yeah, listen, if you have a question, please unmute and ask Dr. Alidia because he's a precious resource for us. I've got a question. Why is it just that the female Anopheles mosquito causes
Right.
malaria? Why not the male?
because only female mosquito bites.
Oh, well, that's a
Only
fundamental
female
answer.
mosquito bites. So that they're the ones who carries the sporozoites. So there's the female mosquito is the one infecting you. So not
Thank you.
all mosquito bites, only the female ones.
I think we may.
Marlene, yeah,
Yeah.
go ahead, Marlene.
I just didn't have my mic down, sorry. Do I have it now?
Yeah, you're good, Chris. Go ahead.
Great, thanks. Quite a few of us that are on this, of course, do not live in a malaria zone. But when we visit, we of course take prophylaxis, and that's why I asked the question earlier.
Oh.
And so the question that extends to then is, as travelers, would we be better off to get a vaccination, which would then of course last for several visits, or would we be better off to continue using prophylaxis?
Yeah, thank you, Chris, for that question. Nice question, because I think you're better off with the vaccine, but I think you should wait for the newer ones.
Oh, of course, right. Yeah,
Because it's
77%
only
is
50% efficacy. So,
Right.
so yeah, so I think, Yeah, so I think there are 5 more vaccines in the pipeline.
Wow.
Yeah. What's the time frame?
That's a better than the first one. So I think you should wait for that, better than the prophylaxis.
Got it. Oh, and of course, short term, we do prophylaxis.
Yeah,
The other
yeah.
question yeah, go ahead. The other
Yeah.
question, go ahead.
Yeah, you can combine actually the two. You have you still have the vaccine, and especially if the vaccine right now is only 50% working, so you can still use the prophylaxis because it's only short term.
So these vaccines that are in development, let's kind of project forward, and hopefully we find one that's in the high 90% efficacy.
Yes.
Um, are there programs being developed in advance for mass vaccinations like we do with polio, or are we still too far away for that?
No, I think we're still too far away from that. I think we're still have to wait for the better vaccines that will be available.
Right.
But they're launching this new vaccine. I think they're launching it in Africa, but it's not to be included in the program of scale grant with Zambia. I think it's not included there in that program. But I think they're going to implement the new vaccine in Nigeria.
Okay, then I also asked the question regarding the 4 species of malaria that affect humans. Can they be hosted by other animals? And if they can be hosted by other animals, then
Yes.
then even though we kind of get everyone vaccinated, that malaria is still going to be out there within the animal realm, as opposed to like other diseases that when we eradicate them, they're gone, they go away completely.
Yeah. But you know, Chris, that once you are vaccinated, you have the protection already against this. So even though if you get bitten again, so you will have already the protection.
Oh no, I understand
from
that.
the vaccine.
Right. Yeah. Okay.
Any other
Marlene,
questions?
do you have any more?
That's it for me. That's all the ones I have.
Okay. Well, I would like it, Dr. Leo, if you could tell us how we can support RAMG or another program.
Well, simply because if you are interested in joining us in this fight against malaria, you can join in with the Rotary Action Group, Rotarians Against Malaria Global, wherein we have all sorts of programs there. Also, you can help fund small grants, 1,000, 2,000 grants to sponsor mosquito bed nets in small endemic areas. That's one. And you can also help us with global grants in large scale grants in the South Pacific and especially in Africa. So that's one way and you can also help us in promoting this advocacy in your area, especially in America, in the States, wherein we can get all the help we can get in helping us eradicate.
Thank you. Can you compare malaria as a problem to, for example, polio? We began in 1985 to address polio when we had about 400,000 cases of wild polio problems with folks. Now we're at 409,000 deaths with malaria in 2019. Significant problem.
Yes, sir. Significant. Still long way to go. Still many hurdles to overcome because especially in Africa. So we try to take it one country at a time. So for example, Timor-Leste is almost certified So we're trying out the whole island of Timor and Papua New Guinea. So one island at a time in the Pacific. Now we're trying one country at a time in Africa.
Okay. So do you have an opinion on whether Rotary should get behind this as a Rotary Foundation project, not just a project of scale in one country?
Yes, I think that's the leading notion right now, that malaria will be the next after polio, because I attended this morning. It's a 1 a.m. webinar about that project, the Zambia malaria-free Zambia project, and they've been into 6 months implementation, and then the Rotary Foundation trustee already gave an idea that it might be the next to polio.
Okay. Well, I'm sure there are a lot of people with passions for the next project after polio, although it seems like we're staying with polio and continue to vaccinate until we're eradicated. We have gone from 2 cases of wild polio to, I think, now 5. There are a total of 1 in Pakistan, 1 and 4 in Afghanistan. It doesn't seem like it's going away completely. So what about REMG? What's been the impact of your Rotary Action Group against malaria since Hamburg? What have you done worldwide?
Oh, so we're almost done with the Timor-Leste community assessment. So we're doing the cross-border eradication. So there will be no crossing on the border of Timor and Timor-Leste. But the significant one that we have progress is this project of scale grant with Zambia. So now everybody is inspired to do the same project with malaria, because now they can see the significance of this project, that it can be a great initiative for all the African countries to do the same. So this has been a flame that we have already started. So hopefully that this will inspire more of the African countries to do the same. So project proposals are coming in from these African countries. So if they can do a duplication of this project. So we're trying to screen them one by one, because the secret for this project is the grassroots levels. If they have established working group already in place in the affected area, without them, it's nothing. It's just paperwork. So we're trying to see if the workforce already in place before the funding goes in, and the policies are already in place, so before funding can goes in.
Thank you.
Are,
thought
are
I just-
mosquito- one more question. Are mosquito nets being distributed in Africa as part of the immunization campaigns?
Yes, they're part and parcel of the whole process. So it's a template for all malaria projects, bed nets, sprayings, and capacity building for health workers. So it's a template that has to be there. That's the reason why they approved the program of scale, because the program of scale has to have a good track record that's being implemented already, and it's being worked with. The policies are there, the workforce are there. So it's a program that's has a good history of success.
Can you give
That's
us
the
an
reason why.
idea? Can you give us an idea of where else it's happening?
Well, because like I mentioned, that all malaria projects has a template for mosquito nets, indoor spraying, and capacity building. So that kind of template is working already. It has a good success rate. So this time it's just being scaled up to a bigger to a wider geographic area. So that's the reason why it's approved, because it's already working. It's already being implemented. The Rotary Club of Federal Way, Washington, has already been working with malaria for 10 years now, also in Zambia. So they just scaled it up to 2 provinces. Before, they just do it in municipalities, but now they try their luck scaling it up to 2 provinces of Zambia.
Thank you.
Okay, anyone else? Do you have a question for Dr. Alidio? This is your opportunity to ask a question, whether it was directly a part of his presentation, or if you have some other question about malaria or disease prevention and treatment. This is a great opportunity to speak up.
One question for Dr.
Carl?
Yes. How much does that bed cost?
Carl, we can't hear you. Can you?
Okay.
There you go.
How
That
much
was-
does the bed net cost?
Oh.
Yeah.
Good question. About $100.
How much?
$100.
Oh, wow. So very expensive for Africa, for sure. Yeah.
Yes, so they need that kind of assist, because the beds are expensive. It's only a few manufacturers make them, but the popular one is the one in Japan. They're the one. Oliset. The Oliset bed nets are made in Japan.
Thank you.
Okay.
So if we were to provide as a culture bed nets for all of the susceptible people in Africa, what would the cost be? It'd be huge.
Yes, it will be huge.
Okay.
So it's not so, Chris. It's not just bed nets. It's I think the more important here is the capacity building and the behavior change of the people. Because if some people don't choose, even though you give the bed, they don't want to use it because they're not used to using the bed. So you have to make a behavior change for them to continuously use the bed nets. Even though anywhere they go, they have to bring their bed nets. Anywhere they go. Even if they want to visit their grandparents or their relatives somewhere else, they have to bring their bed nets. It's a behavior change. So it's not just simply we give out the bed nets.
Is the treatment for the bed nets permethrin?
Oh yes, there's that's an old but they now have a newer one, which is because the permethrin is already some mosquitoes are already resistant to it, so they're applying a combination so mosquitoes will be sensitive to the insecticides.
Would it be more cost effective to use those types of insecticides instead of providing the bed nets? Could you provide the insecticide in a spray bottle and use that? Oh, of course, then you have to get it on the people. Yeah, I'm sorry, a bad idea.
They still use also the sprayers. They spray the inside the household. So when the mosquitoes land on the walls of the house, they also get killed. But I think it's more important is the behavior change and then the capacity building of the healthcare workers to monitor and catch all those affected early on by malaria, so they contain the victims and then the disease itself from spreading. So they do contact tracing. Though the ones in Zambia, the reason why each of the healthcare workers were provided with cell phones is because they need to get in touch with the health authorities immediately. So there's a quick response team that goes to that area and contain the infection. So that's how to control malaria. So the people being bitten by malaria, those doesn't get out of range and spread to other villages. The mosquito has a flight range of 140 meters. So 140 meters, that's the flight range of the Anopheles mosquito. So when there's a reported case of malaria, the community health worker will call a quick response team, and then will cordon off 140 meters, and that they will contact trace all the people within that 140 meters of flight range.
So, Dr. Elidio, it sounds to me like we're putting on a global scale, we're putting more stock in prevention than treatment. Is that true?
Yes, I think it's a better approach.
And is education perhaps the biggest component of prevention?
Yes. It's called sensitizing. They start with sensitizing the people, the affected people, the high-risk people of malaria. So they try to do a massive education campaign starting with children. So they realize the importance of how to of these preventive measures. So they start with sensitization.
Okay, thank you.
I have a question.
Yeah, go ahead.
This is Bill McNair. In New Guinea, you showed a picture, I think, of people carrying the nets on their back because there were no roads.
No roads.
Would roads help there, or do they not want roads?
They're not used to. It's their culture. It's they prefer just to walk. It's their culture.
Okay, so the roads might not help because they don't want them there.
Well, the roads will help in the distribution.
Okay.
But roads are still limited. So if you're from the mountainous areas, you have to do it on their backs.
Okay.
Yeah. Well, listen, Dr. Elidio, I want to thank you for what I think has been a real precious presentation. I appreciate your generosity and time in joining us and educating us. For those of us on the Learning Committee and those others on this call, I think we learned a lot. And I just hope that one of us can be inspired to undertake a disease prevention and treatment project with malaria education, malaria eradication, whether it's funding nets, whether it's funding education, whatever we can do. But it's just an exciting dimension. And it does affect us in this part of the world, although south of the United States and Canada. So thank you. I want to say, please join us on January 11th of 2022, the coming year at 7 o'clock for the next Showcase Tuesday, which will feature vocational service. It's our Rotary International theme, and we'll have two speakers, and they may give you some ideas on what vocational service is and maybe how you can be a part of it. Until then, let me just say to everyone, happy holidays, good night, and be well.
Thank you, Bob.
Thank you.
Thank you. Thank you. Merry Christmas.
Thank you, Noel.
Merry Christmas, yes.
Thank you very much. Good night.
Good night.
So long.